It's okay, I'm here for you.
Pain during sex. It's a really sensitive topic, for sure, but it's also a health issue. And the first step to dealing with it is understanding it. So let's just get right into the facts. So, just how big of an issue are we talking about here? Well, according to clinical reviews, up to 18% of women will experience painful intercourse at some point. That's nearly 1 in 5. So, this is not some rare, unusual problem. It's actually way more common than you'd think. It's just not something we talk about. So, the main medical term you'll hear for this is dyspareunia. And I know it sounds a little intimidating, but it's not a scary word. It's simply the clinical term for pain that keeps coming back either during or after intercourse. Think of it as the big umbrella term that helps doctors categorize what's going on. Now, this is where it gets really important, the location of the pain. Is it superficial, right there at the entrance? Maybe it feels like a burning or a stinging? Or is it deep pain, more of an aching feeling inside the pelvis, especially with deeper penetration? Pinpointing where it hurts is one of the first and most crucial clues for a doctor trying to figure out the root cause. Okay, another key term to know is vaginismus. This is a very specific condition where the pelvic floor muscles, yep, the same ones that support your bladder, they just involuntarily spasm and tighten up. And this is not something you're consciously doing. It's a reflex. But it can make any kind of penetration, whether from intercourse, a tampon, or even a doctor's exam, incredibly painful or sometimes just impossible. One big study found that 31% reported pain the last time they had sex. And this one is critical. About half of women who feel pain don't even tell their partners. It all paints a picture of a really significant and hugely underreported health issue. All right, so let's get into the why. Why does this happen? To make this easier to wrap our heads around, doctors usually group the causes into 4 main categories. And it's really important to know that these aren't always separate boxes. They can definitely overlap and influence one another. First up, we have what are called organic and gynecologic causes. Basically, this means physical conditions that are directly affecting the reproductive organs. This could be anything from common infections, like a yeast infection or an STI, to more structural issues, like endometriosis. That's where tissue similar to the uterine lining grows where it shouldn't. Things like fibroids, ovarian cysts, or even scar tissue from a past surgery or childbirth can also be direct sources of pain. Second, let's talk hormones. Estrogen is the key hormone for keeping vaginal tissues healthy, elastic and lubricated. So anytime estrogen levels drop, which happens in a big way during menopause, but also right after childbirth and when breastfeeding, those tissues can become thinner, drier, and more fragile. This is often called vaginal atrophy, and it's a super common reason for pain. Even some types of birth control pills can have this effect on some people. The third bucket is all about the pelvic floor. Think of these muscles like a muscular hammock holding up your pelvic organs. If that hammock is way too tight, what doctors call hypertonic, or if it spasms, the muscles themselves can become the source of pain. This is exactly what's happening with vaginismus. And often, this can create a cycle. Say you had pain for a hormonal reason. Your body might start to automatically tense up those muscles in anticipation of more pain. And suddenly, you have a new muscular source of pain. And finally, we have the fourth category, which is all about psychological and relational factors. This is that mind-body connection in action. Stress, anxiety, or just the fear of pain can cause you to unconsciously clench those pelvic floor muscles, which then causes pain. A history of trauma can also show up in the body in this way. Now, it is crucial to understand, this does not mean the pain is all in your head. The pain is 100% real and physical. It's just that the trigger is linked to your nervous system's attempt to protect you. And this leads us to what is, frankly, the most hopeful and important part of this whole conversation. This is a treatable condition. There are very clear, evidence-based ways to find relief, and they often follow a step-by-step approach. Okay, there are some definite red flags to watch out for. If you're having severe, deep pelvic pain, any kind of new or unusual bleeding, signs of an infection like a fever, or if the pain is causing you serious emotional distress, please don't wait. It's time to see a healthcare provider right away. Doctors often talk about a treatment ladder. You start with the simplest, least invasive things first, and then you work your way up if needed. So, step 1 is stuff you can do yourself, like using a high-quality lubricant and just having open conversations. Step 2 might be prescribed topical creams. Now, step 3 is a huge one for so many people: pelvic floor physical therapy. This is specialized therapy where you learn exercises to relax and retrain those tight muscles, which can break that whole pain cycle. Step 4 can be counseling to address the anxiety or fear part. And finally, step 5 is about medically treating any underlying conditions, like endometriosis. There is so much bad information out there that creates shame and stops people from getting help. It is time to bust some myths. First up, probably the most damaging myth: it's all in your head. The reality? While psychological factors can play a role, purely physical causes, from muscle tension to endometriosis, are incredibly common, they are identifiable, and most importantly, they are treatable. Next myth: that this is just a normal part of getting older or having kids. Nope, absolutely not. While something like childbirth can be a cause, the pain that results from it is a medical issue to be solved, not some new normal you just have to accept. Pain is a signal, it's not a destination. And then there's the myth that makes people feel so alone. I'm the only one. Like we saw at the very beginning, this is so far from rare. Knowing that up to 1 in 5 women go through this connects you to a huge community. You are definitely not alone. And finally, the myth of hopelessness. Nothing can be done. This is just flat out untrue. From physical therapy to medical treatments to counseling, there is a whole range of effective, proven options out there that can dramatically improve your pain and your quality of life. Okay, so we've defined the problem, we've looked at the causes and the treatments, and we've busted the myths. Let's finish up with some concrete, practical steps you can start taking today to get on the path to feeling better. First, never ever underestimate the power of a good lubricant. Use plenty of it. Second, talk to your partner before, during, and after. Third, be kind to your body. Avoid things like harsh soaps or scented products that can cause irritation. And finally, simple relaxation techniques like deep belly breathing can actually help your pelvic floor muscles to relax. So I'll just leave you with this one final thought. Our sexual health is a fundamental part of our overall health. What could change if we all started treating it with the same seriousness and proactive care that we give to everything else? It's something to think about. Thanks so much for joining me.